Our last session is titled Technology Transforming Care and Wellbeing. And we have three great panelists here today. Kiran unfortunately couldn't join us in person because she's just had a COVID scare, but fingers crossed doesn't yet have COVID, but is playing it safe. These intros are a bit overly long and effusive. I wrote them. I take responsibility. But it's also because we have great panelists who have done amazing things. First off, we have Dr. Barbara Barbosa-Neves, who is a senior lecturer at Monash University and an award-winning sociologist of technology and aging. Barbara is an internationally recognised expert on loneliness, social isolation, and socio-digital inequalities among older people. Her excellence in research has been acknowledged via appointments to key committees, including in the ISA, and speaking invitations across the globe, including over 30 invited keynotes and 70 talks. Among many other awards and honours, Barbara was just this year named a Fellow of the Royal Society of Arts, and in 2019 was selected for the ABC Top 5 Humanities and Social Science Scholars Media Residency Program. Barbara has a background in sociology and human-computer interaction. Previously, she was an associate director at the Technologies for Aging Gracefully Lab, I like that name, at the University of Toronto. And in this lab, Barbara led interdisciplinary teams designing and evaluating digital technologies with and for older people. Barbara's research also explores the role of AI, VR, and robotic companions for social connectedness in later life, with the ultimate outcomes of much of this research being to improve the design of technology for older people and to inform care practices and policy across the world. Barbara has published very widely in journals across sociology, computer science, communication studies, and gerontology and health more broadly. She's also a regular media commentator with her work featuring in ABC News, ABC-RN, CBC, SBS, Channel 7, The Guardian, The Age, and the Sydney Morning Herald. And has also penned a range of op-eds in places like the ABC and The Conversation, and was also recently featured in the SBS documentary What Does Australia Really Think About Old People, where she discussed loneliness and ageism. Also with us in person today is Dr. Jaz Flore, who is a postdoctoral research fellow at the RMIT University node of the ARC Centre of Excellence for Automated Decision-Making and Society, and also a core member of RMIT's Digital Ethnography Research Centre. Jaz's research focuses on the socio-political dimensions of technology and health. Like Barbara, her research is interdisciplinary and situated in two interrelated areas, those being mental health and digital technology, and the other being the intersections of sexuality and sexual intimacies with medicalised techniques and technologies. Jaz's more recent work examines the nexus of digital technology, design and mental health, particularly wearable devices, wellbeing apps, artificial intelligence, and fourth-generation pharmaceuticals. She's penned many articles in journals across a range of disciplines, similar to Barbara. Jaz's first monograph, A Genealogy of Appetite in the Sexual Sciences, like another great title, A Genealogy of Appetite, was published in 2020. Her second monograph, Digital Mental Health Technologies, Algorithms and Smart Devices, is coming out later this year.
Hopefully.
That's pretty cool. Currently, Jaz is an investigator on an ARC linkage project on borderline personality disorder, and has quite recently undertaken research into the lived experiences of creative arts workers during the pandemic and the automation of mental health care through apps, particularly as a means of responding to loneliness and isolation during the pandemic. And finally, with us on Zoom is Dr. Kiran Pienaar, who is a senior lecturer in sociology at Deakin University with expertise in gender, sexuality and health. Her theoretical interests include feminist science studies, new materialisms and post-humanist approaches. Before joining Deakin, Kiran was a research fellow at Monash, where she retains an affiliate role. Kiran has published widely in the areas of health and disease, with a particular focus on the sociology of pandemics, addiction and the self, drugs, sex and embodiment, and social aspects of health and digital technologies. Like Barbara and Jaz, Kiran's research is interdisciplinary and empirically grounded, offering new insights into topical issues such as the politics of public health, LGBTQ identities and cultures, and most recently, the uneven effects of the COVID pandemic. Again, like Barbara and Jaz, her research wants to inform health and social policy, particularly in relation to interventions for marginalised communities. Again, Kiran has published widely across a range of journals and disciplines, and her first book, Politics in the Making of HIV/AIDS in South Africa, was published by Palgrave in 2016. Kiran has also worked on several ARC-funded projects on topics ranging from diagnostic testing to experiences of addiction. With colleagues at the University of Sydney, she is a chief investigator on a discovery project exploring drug use in queer communities. She is currently leading a new interdisciplinary project exploring the racial and cultural politics of Australia's COVID response, focusing on the impact of COVID restrictions in public housing communities with a view to informing more equitable, inclusive pandemic responses. Let's give them a clap for everything that they've done. So first question for the whole panel. Thinking back to what feels like a lifetime ago, and I know you probably don't want to talk about it at all, but when COVID-19 first reached a tipping point across the globe, there was an unfathomable amount of debate and speculation about the impacts the pandemic would have on familial relationships, friendships, how we care for one another, how we care for ourselves, romantic and sexual intimacies, and what role technological affordances might play in enabling or disabling those expressions of care, affection, connection and belonging. So none of us could obviously really comprehend the whole scale of what was happening, but what were the main points of concern for you in thinking about well-being and care during the pandemic? What role technologies play in that, and how did those concerns shape your work over the last couple of years? Can I start with you, Barbara?
Yes, sure. Thank you so much, everybody. Thanks so much for being with us here today. Let me just apologize for my raspy voice. I don't have COVID. It's just the end of semester fatigue has really affected my vocal cords. Can you hear me in the back? Fantastic. And thanks for the introduction as well. Usually I always say I'm just Barbara. Hi, I'm Barbara. So thank you for that. So I guess from my perspective, I think we as sociologists always think about how this kind of socioeconomic crisis can really affect inequalities, existing inequalities, at the micro level and also at the macro level. So we do have a long history in our discipline about thinking on those inequalities, what kind of inequalities actually are exacerbated with pandemics, and which ones are we able to address. And so I think that provided us with some conjectures and some hypotheses to work with. In my case, it was quite interesting because on the one hand, there was this new wide global agenda focusing on loneliness. Suddenly, it was in the public domain, it was in media discussions, we're all talking about loneliness. And this was because I think we realized that, wait, loneliness does not only affect older people, it can affect all of us. And so suddenly it was interesting to see this renewed interest in loneliness, which I was hoping it would help us destigmatize it and separate it from the mental health epidemics, air quotes here again, because loneliness is not a mental health issue. And so on the one hand, we had this kind of probably a positive outlook into how can we address some of the issues that we work with. And then we also had, of course, this focus on a new lens on the social technical affordances of technologies for our social technical systems for social connection and interaction and inclusion, which also kind of brought a new lens on both the opportunities and challenges. So in my case, it was interesting to see that intersection coming to the fore. Of course, loneliness is not a new issue. Before the pandemic, the UK government appointed the First Minister for Loneliness. So it's not, but it certainly was in our public agenda. So it was quite interesting. And so that shaped my work in the sense that I was already doing research on loneliness and technology, but my focus was mostly with older people living in aged care facilities. I was not able to enter any aged care facility in Victoria, so all my research stopped. And so I had to, and I hate this word, but I'm going to say it, to pivot, air quotes, my research. And so, and it wasn't really pivoting because I already worked with older people living alone before, but my focus shifted. And so I focused on older Victorians living alone during the pandemic And my research was about understanding their lived experiences. And I'm talking about older Victorians who already felt lonely before the pandemic. So they live with prolonged, persistent loneliness. And to understand if they were using digital technologies during the lockdowns, and if the technologies they were using were actually helping them address their feelings of loneliness, yes or no. And so that was how it kind of shaped my research. Also, I realized that, and I think this is something that we also have to talk about as a discipline, and this is a conversation amongst peers, but I was really concerned about, and I do understand the importance of that kind of quick and dirty research at the start of a pandemic with those snapshots of quick research, but I was really worried that would affect the substantive work that we do as sociologists. And so I really wanted a long-term, deep engagement with my participants. And so I did a longitudinal mixed method study with them, which also included diaries. So I asked them to write diaries during lockdowns, because I also wanted to empower them as research partners, not just as subjects or participants. And so I think the pandemic, for me personally, as a sociologist, really kind of teased out the importance of that kind of long-term research and empowering our participants, understanding that we are using their stories that then are commodified and then become academic metrics. And so I think it brought to light for me a new way of thinking about that kind of responsibility, and I don't want to, I'm going to use Norbert Elias' kind of idea of sociologists retreating to the present, or what Harriet Martineau would say, what is a sociological present if we don't have a sociological past? So I think for me it kind of shaped that way of thinking about my own research.
Yeah. I mean, that's an amazing articulation. Yeah, hopefully we'll come back to some of that work you did in terms of participatory designs and co-working, because it seems when the pandemic hit, this was the moment that social scientists have been waiting for. All our expertise will come to the fore now, but the risk that you alluded to is that it becomes this very extractive exercise of almost cataloguing people's suffering but not actually returning anything to them, either therapeutically or just on a basic level of respect and reciprocity. Sorry, Jazz.
I was just going to react to that last point. There are very strong institutional pressures for us to do that quick work and just, produce something and it's out there and I've met my metrics. Yeah. Being a mental health researcher during a pandemic is a great adventure. It's been a very... It's weird because at the start it was also kind of we all shift online and there's this kind of lull of almost boredom that happens where you've lost contact with your colleagues. In mid-2019, I started a new position at RMIT and I went in there with a lot of excitement and a lot of plans for 2020. And, like a lot of people, that was completely trashed as... was the big shock of living with international borders being shut and having my entire family overseas. So, there's just, as a sociologist of mental health, there's always this, we know this as sociologists, you cannot be a dispassionate observer of your subjects. You write yourself into what you produce. And I feel like with the big focus on mental health during the pandemic, that's become even more intensified, if that's possible. So suddenly it was interesting because it felt like a convergence of many different things. A lot of the problems in the mental health system predates the pandemic massively, but then at the same time, the findings of the Royal Commission into Victoria's mental health system was coming out. And suddenly the federal government has a deputy CMO for mental health, I think within 3 months of the pandemic in 2020. To use a tech word, everything became augmented. Everything. The urgency of helping people, the urgency of doing research. We saw some, universities claiming, we're all COVID researchers now, we all need to be doing this. So it was a lot of confluence of pressures from many different sides, for me and I'm sure for a lot of my colleagues. And I should mention here the number of colleagues that we've seen lose work as well. And speaking of mental health impacts, that was a huge one. So my interest in digital mental health predates the pandemic, and I'm always very interested in how we talk about new and emerging technologies and the hype that inevitably goes with that. And so it was only last year that I finally got the resources together to do a small study with young adults on their uses of apps and wearables for their mental health. And I'll talk about that a lot. But one of the things that became very clear and maybe intensified through the pandemic is that on the one hand, governments pour a lot of money into crisis helplines, which is a good thing, but there is a big bunch of people not reaching out to crisis helpline who still need help, and they might speak about having a mild sort of mental health challenge, and a lot of them will turn to technology for various reasons, one of them being it's very expensive to see someone, or they don't want to speak to someone because of trust, of access, many different reasons. And so I spoke to people with a lot of very different experiences of those technologies. I've spoken to people who managed to combine using apps with seeing someone. So I've spoken to someone who very interestingly sent data from her app to her therapist, and then would meet with the therapist afterwards to talk about it, talk about how her mood is, tracking, that sort of thing. So it's been a very augmented time. Yeah.
Fantastic. We'll throw over to Kiran now. Graham will just turn up the volume.
Thank you so much. Can you hear me? Shall I wait for a thumbs up? You can? Yep. Great. I just want to say a huge thank you to Matt for being so accommodating with this last minute change. And I'm really sorry not to be there in person, particularly after that very warm and effusive introduction. So I guess similar to Barbara and Jazz, I get the sense that we share a thread and an interest in how pandemic containment measures or how this shift to a kind of new augmented world, how that affects particularly those who are marginalised. And of course, this is kind of a perennial interest of sociology. So that's been one of the key concerns of my work in this space. My background is in the sociology of HIV. So I was particularly interested in how have the pandemic responses affected marginalised communities, and also what kinds of community responses have emerged and what kinds of practices of care, and how do they align or possibly not align with public health measures. So I guess really one of the key questions that has shaped my work, and I'll talk a bit more about this and some of the work I've done with Jazz, is what are the assumptions implicit in pandemic containment measures, and what kinds of imaginaries do they rely on? And I think in the previous panel we saw really nicely some critiques of the kind of home that is imagined in the injunction to stay home, stay safe. Middle class suburban home that is supposedly a safe haven, even though we know that private homes are where the majority of domestic violence happens. What kind of household is imagined, what kind of family, a nuclear family, and this echoes what Kay was saying in the previous panel about domestic violence, care work, and reproductive labour that have shaped our shift to working from home. So there's some beautiful resonances across the panels. And I guess also who is the ideal subject of COVID public health responses, and how do the responses construct health publics in narrow exclusionary ways? And I'm really heartened to hear what you said, Barbara, and Jazz echoed it, that in the early waves of the pandemic, I think we saw a lot of rapid-fire commentary. And like both of you, I was quite concerned that there didn't seem to be much empirically grounded, substantive research. And of course, I understand the need to respond as things are happening, but I think we didn't see, or certainly not to my knowledge, there wasn't much critical research addressing the social and political dimensions of pandemic responses. And these are concerns that I think really animate sociology. So we've been keen to address these issues, and we've done an analysis of public health measures and pandemic discourses, looking at, as I mentioned, the kinds of health subjects that they construct, and particularly how the subject of public health advice, the subject that's imagined, is monogamous, coupled, living with their partner or nuclear family, not a precarious worker, usually a knowledge worker who can shift and transition to work from home, as our previous panelists mentioned. And we noted that those who are not in these kinds of relationships or households, including older people, people in detention, homeless people, they're not only excluded from this kind of narrow enactment of the ideal public health subject, but they're actually rendered potentially risky disease vectors by virtue of not conforming to the imagined ideal subject. And I think we've seen this play out really insidiously in the lockdowns in public housing, both mainly in Melbourne, but also in the response to the outbreaks in southwest Sydney, where residents were treated as potential sources of contagion, which had to be contained in the name of public health. So I guess we're really interested in what kinds of communities are imagined, households, families, and who gets excluded in the name of public health, because very often public health is kind of inoculated from critique, because we think, oh, well, it's for the good of the community, it's to protect us all, and we've heard politicians say that, and I think as sociologists, we just want to subject those kind of blanket statements to critique. So yeah, that's been what's really interested me in the last couple of years.
Fantastic. Thanks, Kiran.
Just wait a second.
Sorry.
No thanks.
Okay. All good?
Yeah.
Yeah. So that leads on nicely to the next question, actually, where a shared theme in all your research is not just loneliness, not just disconnection, but abandonment of people, and how those forms of abandonment are perhaps kind of rationalised by the state, and how it is felt by those subjects who experience those forms of abandonment, because they're seen as either kind of deviant, risky, or just simply kind of non-grievable in some kind of way. So are you able to talk a little bit about that? Maybe we can start with you, Jazz, about the experience of creative arts workers maybe during the pandemic?
Yeah, totally. Thank you. Dispensable. That's the word I would think. So before I talk, I just want to acknowledge my collaborators on that project, Natalie Hendry and Avril Gaylor, who Avril is doing a PhD at the Trobe. So my interest in this area was initially about sort of trying to understand the mental health impacts on a group of people who were simultaneously very precarious, but also a lot of the kind of institution in that field were like, oh, you can pivot your work digitally, you can do this, you can produce content and teach dance classes on Zoom, that sort of stuff. And so we designed a bit of a free-flowing qualitative survey. And the most surprising thing to me, but that's probably because of my own lack of knowledge of the industry going in, is that a huge number of people who responded were not performers. They were technical workers, administrative workers, and they can't pivot online. There's no way for them to do that. And it's interesting because there's so much ambiguity in their experience overall. First of all, they're very aware that the arts, in their assessment, and rightly so, were not as valued historically, especially in recent years in Australia. They've all pointed to the fact that increasingly successive federal governments would talk about the creative economy instead of talking about arts and culture. So there's always been that push for them to be entrepreneurs. And it's interesting because on the one hand, some of them resent that, some of them really value it because it gives them a lot of flexibility. A lot of them do not want to work full time. They enjoy having those multiple contracts, but that's contingent on not living in a pandemic. Because as soon as that happened, all those flexibilities and contacts that they had, the networks that enabled them to have that flexible work and the lifestyle they wanted, was completely gone. So it's interesting because they're a great example of living with precarity, if I can put it that way. But with the shift to online work, it just, life became a lot harder for them. There was a lot of frustrations about this claim that they could work online. A lot of them had very profound grief because they lost the audience. And even those who were trying to do things digitally were very kind of, I cannot do theatre online. I have no vibe from my audience whatsoever. And how can I ask people to pay for my performance if I have no connection with them? And that sort of loss of the audience was very, very stark. And then the total abandonment that administrative and technical workers felt was pretty intense. And some of them were like, oh, well, I tried to reskill and train in something else, but even that was really hard to do online. And one of the things that I should mention, because Alexia is online, is that, and we just did this report on digital infrastructures after COVID-19, is that was also a big problem for people. While theoretically they could do something online, there's the problem of access, there's the problem of sharing your bandwidth with multiple people in your household. Having good enough equipment to be able to translate something meaningful to your audience was a huge issue as well. And then it's the other way. The audience needs to have a really good digital access as well. So there were the arts sector felt very abandoned by federal and state governments. And it's been very hard for them. And I've seen articles yesterday, I think, about the big hope of renewal now that the federal government has changed. We'll see. I don't know. But I think, and that's a theme that runs through my work, that idea of techno-solutionism, that technology is going to solve the great social, economic issues of our time, is so problematic, but also so very entrenched in how we lead our lives. One of the things that the Digital Infrastructure Report points to at the end is that a lot of the ways we talk about technology reproduces the language of hype, in the sense that we think that it's quite new technologies. But a lot of them are not. They've been with us for a long time, but they're a lot more visible now. And access is a huge issue. A bit long-winded way to answer.
No, that was fantastic. Barbara, I know we could talk all day about abandonment in aged care. And
I found this on the web.
Oh, sorry. That's my keywords.
Is that because I said your name? Sorry.
Yeah. I said Barbara.
My bad.
My Siri was like, what? Sorry.
It's techno-solutionism in practice.
Techno-solutionism everywhere.
Were there particular forms of abandonment for older persons that you noticed during the pandemic?
In aged care or more generally?
Either.
Right, thank
That's
you.
not helpful.
Because my work stopped, in aged care stopped during the pandemic, I'm just going to talk about my work with older Victorians living alone. So they were already experiencing loneliness before the pandemic. And there was a lot of conversation at the start of the pandemic saying, well, older people who were already lonely are now, and I also hate this word, more resilient to the loneliness that is coming from the pandemic, or that is emerging with the pandemic. And it was interesting to actually especially look at the diaries that they wrote. So we worked with 35 older Victorians. We had different waves of interviews, some loneliness scales as well, but the diaries, I think, were what we actually could see in a more bottom-up approach what they were feeling. For our participants, it was really interesting because the pandemic actually exacerbated their loneliness. So before the pandemic, they already feeling lonely, they live alone, they do have a lot of management or coping strategies that were volunteering or doing something in the community. Everything stopped with the pandemic. And so those attempts to manage their loneliness also stopped. They try to kind of find new ways of managing and coping with that. But what is interesting about, I guess, this group of research partners and participants is that they all say that they don't want to talk about their loneliness to loved ones or to family members because they already feel stigmatized. They are old in a society that doesn't value being old. There's a kind of personal failure It means that they don't have the social skills to be interesting anymore. No one really cares about them anymore. They're not interesting. And so there's a lot of issues there around social validation and the kind of playground dynamics. We all want to have friends and be loved by friends. So for them, admitting to loneliness is such a big thing. It just compounds stigma on top of stigma on top of stigma. And so they prefer to suffer in silence. And so a lot of their coping strategies are just trying to distract themselves from loneliness or to help others. So that's why they do a lot of volunteering. That stopped with the pandemic. Now, they did try to use digital technologies and rely more on digital technologies to address some of their feelings of loneliness. And it was interesting because there's a lot of temporality to their loneliness. So before the pandemic, they would feel it in the morning or in the evening when they would get home. During the pandemic, it was throughout the whole day because the house is also a reminder of their loneliness. And so through digital technology, a lot of them tried to address some of their feelings of loneliness. A lot of them already relied on technology before, and so this was just a way of finding new ways of using video conferencing, social media, and so on. But they all wrote about how it was not enough. So the communication via technology helps, but it's insufficient to actually fully address their loneliness, because loneliness is that feeling associated with missing meaningful connections, companionship that is meaningful to them. And so technology would help when they felt included and valued. So a lot of them wrote about how online gaming with their grandchildren was really useful, or when they were helping their grandchildren with their homework via Zoom, things that actually made them feel valuable. But also we found a bit of digital ambivalence there. It didn't help when it was very quick, short calls. And as the pandemic progressed and lockdowns progressed, the calls that they were getting from family members were shorter and shorter and shorter, because families were also struggling with homeschooling and working from home. And so that ambivalence was quite interesting, because yes, technology can help, but can also make it worse. And when they had those short calls of 1-minute calls, as one of our participants put it, actually increased their sense of loneliness and disconnection. And this is something that sociologists of technology have been talking about for many, many, many decades. Technology can help and can make it worse, depends on that social technical context. So that's what happened with my participants.
That was a fantastic summation. Thank you. I'll bring Kiran in here. Kiran, you already talked about the Making Publics in a Pandemic paper that you wrote. Not yet, Graham, sorry. On which you were the lead author, and you talked about the kind of exclusion, dismissal, invisibility of kind of non-normative relationships and households. Are you able to talk a little bit here about the more recent work you've been doing on the experiences of persons in public housing during the lockdowns and that sense of abandonment, perhaps?
Yes, sure. Thanks, Matt. Can you hear me? All good?
Yep.
Great, thank you. Sorry, I feel I have to keep checking because I have no sense. So on we built on that initial piece of work. I was really interested to explore how lockdowns affected residents of public housing. And initially, the project that we devised, and it's a very small project with some Deakin colleagues, we got a small part of internal funding, and it was initially going to look at experiences of the hard lockdowns, and this has evolved because we found it really difficult to get participants who were affected by the hard lockdown, so those in North Melbourne and Flemington, and B, we realised we've got an epidemiologist on the team who felt quite strongly, and I think she's probably right, that after the Ombudsman's report was released, it seems quite unlikely that we will see further hard lockdowns. I think there's a recognition that they violate human rights and that they're problematic in all sorts of ways. So we've expanded the focus of the study, and it now looks at experiences of public housing residents more broadly, just recognising, I guess, that they do face unique challenges, not least because they have shared common areas, they have high density living circumstances, limited outdoor spaces, And interestingly, and I'll be really keen to engage with your work, Barbara, I hadn't expected this as another unexpected surprise from the project. All of our participants to date, and we've only done 15 interviews, so it's a small set of interviews, they're all over 55. We've really struggled to recruit younger people. And so the stories that we're hearing are of a particular demographic in terms of age. Of course, there are particular SES as well. And we've had, so as you'd expect, accounts of participants who describe feeling especially marginalised due to the fact that they live in public housing, especially stigmatised because of that, and experiencing unique challenges. But we've also heard stories of, and I hate this word, but I'm going to use it, resilience and strength. So people who've managed to cope despite the challenges, communities banding together to support each other and alleviate the stress, and as Barbara was saying, the loneliness of lockdown. So it's really quite mixed, and I suppose because the research is unfolding and this has been a uniquely challenging project in a lot of ways, not least because it's a new area for me. I don't have a lot of connections in public housing, but something that's come up really strongly for me that I hadn't expected is that public housing residents also felt they were more visible than they had been before because of the recognition that they constitute, their sites are high-risk sites for infection, which has also meant, and this has been a positive effect, that the state government has positioned health hubs in each of the foyers of the buildings, and the health hubs are not only to offer COVID health advice and masks and things like that, but also direct them to other services. And this has been a really positive effect of the lockdown or of the pandemic, and many of the residents that we've spoken to have commented on this and said that they'd really like to see the health hubs maintained. And there is a risk, of course, that now that we're, some people say we're moving out of the pandemic, that they won't have access to those hubs. But it's been really important for them. Also simply, and I guess connecting to Barbara's work, a lot of them live alone. In fact, all of our interviews so far, we thought we'd do household interviews, but all of the residents live alone. We thought it would be multi-generation households. But the over 55s, they are quite isolated and lonely. And a lot of them said, I'd just like to go down to the foyer once a day and have a chat with a nice lady, as they say, the nice healthcare worker, and it's my little bit of social connection during the day. And they said that particularly during the long lockdowns that we had in 2020, 2021, that was a really significant source of social support. So I guess that is a positive for many of them that I hadn't expected to come out of the pandemic and the state response. So I guess kudos to Dan Andrews and the state government response in that regard.
Thanks, Kiran. I don't have a neat segue. Sorry. I don't have a good segue for this, but we're going to shift away from COVID now, and we're going to talk about AI and the automation of care. So this is not an area I know well, but I know that, since that first Eliza chatbot in the 1960s, right, there's been like this...
So sexist, indeed.
Yeah. With
Still used today.
With that, there's been this recognition of it having like therapeutic potential, that this was a form of talking cure for some people. And so there's been this kind of fascination with the potential of automating therapeutic care at scale, not only at scale, but also personalising that care as well through automation. But it comes with a huge amount of risk as well. And so for Barbara, I guess this is too broad a question, but how is AI being incorporated into aged care facilities?
What is AI? What is AI?
Yes.
Thank you.
Narrow AI as it exists today.
Thank you. So it's interesting when we talk about artificial intelligence, because as Jazz was saying, we have this idea that AI is something really new, but this idea of thinking machines has been with us almost as a species, because even in ancient history, there's ideas of thinking machines. The Talos of Crete was the automaton that was going to defend Crete from the invaders. So we always have this idea of thinking machines, robots, AI comes from that. But the AI that we think about today, contemporary AI that has been developed with neural networks and machine learning, is based on predictive models that hopefully will help us with some of our social struggles. Again, the message with AI is quite interesting because, as we know, aged care is in crisis. And the pandemic, I know we're not supposed to be talking about COVID, the pandemic is ongoing, it's still happening, and we can see still how the sector has been challenged in terms of their capacity to provide quality care, staff shortages, and things like that. So we know aged care is in crisis in Australia, and so AI has, even before the pandemic, been promised as the solution to all our problems. The techno solution technology is gonna solve all our problems. It doesn't mean that AI can't help, but it can't help alone. And so what we see in aged care is very interesting because it's this hyper idea of AI that is what we call in sociology of technology, technological determinism, or it's going to save us all, or it's going to doom us all. And so we conducted a study on AI in aged care with colleagues from Monash, Alan Peterson. We also had colleagues from other disciplines, Adrian Carter from neuroscience, and also a colleague from computer science, Moore Verret. And what we were interested was in understanding how different stakeholders would perceive AI. First of all, what is AI for them? And then how do they think about AI in care? And it was, of course, interesting, but probably not that surprising that AI developers had a very utopian, very positive understanding of AI, and aged care staff was like, they were like, not so fast. And so what we found was this kind of ambivalence in terms of their narratives, but also their imaginaries. So AI developers, of course, were very surprised that their technology was not being received with open arms in aged care because they have the solution to the aged care problem. And it was funny because they all have those, I'm going to use a term that we use a lot in sociology of technology, which is user scripts or user representations of the older person, which is, of course, embedded in techno-ageism, these ideas of the old. So they all had a story, a family story that led them to develop this particular AI. And it was mostly robots, smart sensors, and voice assistants like Siri. So they were surprised that technology was not being really, there was no uptake of the technology, but they also didn't have a really broad understanding of aged care practices, their constraints, and the ecosystem. They never thought about interoperability, how that technology would work with all the other technology that already exists in aged care. And so it was interesting. On the other hand, the aged care staff members had those fears about those kind of sci-fi ideas of AI, that the robots are going to come and kind of replace us all, and they probably will replace some of the tasks. But there was this very interesting idea of this techno-dystopianism about, and they had, of course, important and legitimate concerns, dehumanization of care. They all operated within that cold-warm dichotomy of care. So humans provide warm care, technologies provide cold care. And so they were, of course, worried about also the reliability of AI, accountability. What's going to happen if the AI malfunctions? Who's going to be blamed for that? Because of their understanding of risk, this was such a prominent issue for them. But what was interesting for me was that across both stakeholders, there was still a reliance on that idea of the one-size-fits-all, which I thought by now kind of we all understood that it's quite limited because older people are a very heterogeneous group with different needs and aspirations, even in aged care. So older people in aged care are all different. But there's still that idea of the one size fits all. And then we have the techno-ageism from the AI developers and the aged care staff. There's this idea of kind of what we call benevolent ageism. We need to care for them. There was no ideas of, in the interviews that we conducted with both stakeholders, of autonomy or dignity or agency of older people. They are people that we need to care for. It's always that kind of understanding. So I think AI has been maybe augmenting also our discussions and our ambivalence towards this kind of human-technology relations. If that answers more or less the question.
Amazing. Yeah, Jazz, in terms of your work with young people using the mental health apps, I mean, there's lots of things you can play with there in terms of, it seems some of those users actually had a warm relation to that technology, that it did feel quite personal, but at the same time it was the extension of the clinic in a boundless sense, and then a whole collection of data about the self as well that was then shared with others in that great example that you raised. Is there anything more you can elaborate on that?
Yes. Do you have 3 hours? So AI in mental health, my kind of field of study is much more deregulated. You know, it's people using it in very ad hoc ways. A lot of the apps are free, though some of them actually the AI functionality is unlocked if you pay for a subscription. But I have quite a few AI chatbots on my phone as well. Just one thing I wanted to say about Eliza, and this is why mental health apps that use chatbots, you know, chatting robots using AI are so fascinating, is that Eliza was initially designed on the principles of a form of psychotherapy that was meant to be client-centered in the 20th century, and then was completely repudiated by the person who initially designed it. But the principles are incredibly similar when you chat to the AI on your phone these days. In terms of the people I've interviewed, it's interesting because, I think that very often developers view younger people, I've only worked with young adults, so over 18 up to 25, 26, view them as really easily convinced adopters of new technologies. And some of them are, I will not deny that, but they're also incredibly easy to abandon technologies as well. When it doesn't work for them, they will. And so one of the really interesting things that came out of my study was how the chatbot can remake ideas of friendship. Some people really did want the AI to respond with empathy, even when they were very distressed. But because of the responsibilities that corporations have, the answer was always, you should call whatever your helpline is in your country. And then there was this frustration from one of my participants because they were like, but no, I want them to be empathetic. I do not want to speak to a person. I want to speak to the AI, which, when you think about it, is essentially talking to yourself because you're training the AI to respond in a certain way. But there is this real expectation of forming connections with the AI that people want. And at the same time, I've interviewed people who were incredibly frustrated with it and tried it twice and abandoned it. I've interviewed people so there are apps that do mood tracking, and then if you want super analytics with AI, you have to pay for a subscription. Someone paid for it, someone did not, same app. So there's a lot of really kind of contextual things going on there as well. I guess it's really fascinating because on the one hand, to your point about extending the clinic, yes, I totally agree. But on the other hand, there's a really nice to my mind, disruption of psychiatry there because most of the people I interviewed had no diagnosis whatsoever and had no interest in it, even if they spoke to themselves as having an experience that possibly could be diagnosable. Also, I really was quite surprised and impressed by how they would use that sort of automation of care and AI to create spaces for themselves that we don't necessarily associate with mental health. So, the bus, chatting to your AI on the bus because you feel really overwhelmed. Someone went to a class and some pretty distressing topics were raised, went out, did some sort of exercise with their AI on their wearable, went back to class. It's a corridor at a university with 20 people walking past. So there is this, I think ambiguity is the word there, or ambivalence is the word. And those sorts of deregulated spaces are both problematic because it's about corporations, what are they doing with your data? But then I also have a problem when it's clinicians getting together with corporations to create an app. I think that also raises a lot of issue. It's problematic. Yeah.
Maybe we can bring in Kiran here because Kiran, I know it might have been a couple of years ago now. You did some work in terms of chatbots in alcohol and other drug counselling. Is there anything you want to add to this as well?
Yeah, thank you so much. It echoes much of what Jazz and Barbara have already said about ambivalence. So we did a project, and this was led by Michael Savage and Tony Barnett at Monash, so I should really acknowledge them here. And we were interested in both client and counsellor perspectives of chatbots in online counselling. So we did several interviews, I think it was 20 interviews with clients, and 4 focus group discussions with counsellors. And very similar to what you both are talking about, both clients and counsellors were really, they were ambivalent about the use of chatbots. They felt that they lacked a human element, which I think echoes what you were saying, and they really obviously value this human element in empathic care encounters. But they weren't entirely negative about chatbots, although I should say, countering that kind of techno-solutionism, they did evoke, quite similar to what Barbara was saying, that dystopian imaginary of the chatbots taking over or robots taking over domains that really should be the preserve of humans. So that there was that element, but they also suggested that perhaps there was some value in narrow AI, as we refer to it, and that might include things like performing discrete tasks, so like triaging clients, screening, referral. And they actually were quite receptive to the idea, and this is both the counsellors and the clients, that maybe humans and chatbots could work in unison to perform these simple, basic kind of data gathering tasks. And this might free up humans to engage in more complex activities. So I guess they were, echoing what Jazz and Barbara have said, they were ambivalent about it. And we've talked or referred to their views as kind of suggesting or elaborating more than human care, and recognizing that perhaps a more than human model of care would acknowledge care as distributed across the human and non-human spectrum, and recognize some of the affordances of AI-driven technologies without limiting or without foreclosing the central importance of empathic care. And that's the kind of care that I think, and maybe I'm too humanist in this, but I think it's really the preserve of humans. So yeah, complex and mixed views, but definitely not entirely negative about the use of AI technologies, and that was from both the perspectives of clients and counsellors.
Great. I know we're running short on time. We started a bit late, so we might run a bit over time if that's okay with folks. So just one last quick question before we throw to the audience. A lot of the work that you all do involves working with marginalised, stigmatised or vulnerable populations, interdisciplinary collaborations with big teams, participatory forms of research, working with other stakeholders as well, creative and experimental methods. Combining all these things increases the risk of it all falling apart, obviously. And so a lot of academics are kind of disincentivized from even trying that kind of work. But is there value in risking failure? And Barbara, do you have a consoling story to tell us about?
I have. My life is made of failure. Thank you for that. Well, I think I come from a perspective where science is always failure, is always uncertainty. Research is messy. Research is the art of the possible. So I always embrace failure, but I think it's not just about embracing and recognizing failure. It's also about taking responsibility for the failure. And I think that's the problem sometimes. And so I think, again, it's really important to recognize failure. It's really important to embrace failure, but it's also important to take responsibility for it. And so I think that if we want to really decolonize sociology, if we want to make the discipline more diverse, we also need to think about these issues. And I think all research, not just interdisciplinary or applied research, has I'm going to use Robert Key Martin's expression of negative unintended consequences. Pure research has the same. It's just we never reflect on that. And so I wrote a paper recently about my own failures. I co-designed a technology with computer scientists and with older people, so it was co-designed with our end users. to help address loneliness in later life. Now, I was in computer science before, so this was developed within a computer science department. And bless you. And the technology was mostly successful, but it did make 2 of my participants more aware of their loneliness when their family and friends did not reply to any of their messages that were sent through the app that we designed. And so these were extremely frail older people that I worked with for over a year. And so not only there's failure in terms of the technology failed for them as I failed them, right? And so I think it's really important to understand failure from that perspective, that I think we need a more dynamic understanding of a duty of care and what that means, but we also need to write about it. We need to report it. And I think there's this positive bias in research and in publications. You don't publish about what didn't work. But we need that, because otherwise we keep making the same mistakes over and over and over again. So I think that's really important. And the other thing I would say is that beyond recognizing and kind of embracing failure, and I'm not just talking about limitations that we all write in our papers, which is one sentence of limitations, and I'm not talking about that reflexivity that we write in the method section. Oh, we're all very reflexive. Yeah, that's okay. And we all do that. And this is a criticism of my own work. I'm not kind of not saying that I'm not the one to blame as well. I do the same. There's a one sentence of limitations. There's, yes, all the researchers engaged in reflexivity, full stop. Findings, and then we describe the findings. So I think this is really important, but also in how we promote and disseminate the work that we do. I've been thinking a lot about this because there's this ethics of representation that we need to engage with, and I'm always struggling when I'm talking about my participants, because how can we actually describe and communicate and promote our research without othering and further marginalizing our participants, without essentializing them or reducing them to the topic that we're talking about, in my case, loneliness. And so how can we do better in our communication of our research as well to ensure that we are not kind of reproducing the inequalities or perpetuating the inequalities and the marginalization that we are trying to address? So I think those are some of the questions that I'm dealing with now.
Yeah.
For all of you to answer. So then.
Jazz, did you want to add anything to that?
Oh, just very quickly, doing work in mental health with sometimes very stigmatized populations, it's incredibly political. And there's a lot of, so I'm on a project on borderline personality at the moment. It's a highly stigmatized and very stereotyped and very feminized diagnosis, and the project has a lot of industry partners and an advisory board of people with lived experience. Incredibly political. The number of varied views on issues that you have to deal with is pretty intense, and I guess it's frustrating because you're a mental health researcher, you put stuff out there, and sometimes you even publish in journals that practitioners will read, and we work a lot with practitioners on this project, and nothing changes. And there's a lot of frustrations there, and sometimes you think you're doing your best to be participatory and inclusive with people, but you often fail. There's a lot of politics to who can claim to have a lived experience, who will sit on different boards as well. Is your lived experience, valid enough or intense enough, or that's the story we want to hear today on this board? Attached to that is a lot of failure, and I don't know what the answer is, except to just keep pushing through and hoping for the best, or hoping that once I'm no longer an academic, no longer an ECR, some other ECR comes along and finds a solution to all those issues. I'll just keep creating problems. I think actually, that's my conclusion. Creating mess is a good thing for sociologists, and we should keep acknowledging and working with mess. Yeah,
absolutely. Yeah. Kiran, anything you'd like to add to that?
Yeah, thank you. That was so stimulating and generative. And I agree absolutely that failure can be productive and there's value in losing one's way, embracing the mess. But I also want to acknowledge that I find that it's hard, it's tricky. I am reminded of Halberstam's The Queer Art of Failure and the value that it credits to pursuing difficult questions. And I often say to my students, I teach a research methods course, that they should expect to be surprised, and being surprised by your research is a good thing. And pursuing the confounding evidence and trying to make sense of it is valuable. And I try and do that in my own work. I have to say, my most recent project, I think it's really affirming to me that we're open and humble enough to kind of commit publicly or discuss our failures or the challenges we face, rather than trying to eclipse them or sideline them. And some of these challenges in the context of my work recently has been working in an interdisciplinary team where we come with different epistemes, different ontological assumptions about what we're doing, and also working with communities, as Barbara was saying, and in Jazz's case as well, where they are deeply stigmatized and marginalized. I feel quite a profound sense of responsibility to do justice to their stories. And in this project in particular, whenever I'm doing the interviews, I'm constantly struck by how the questions are about COVID, but there are so many fascinating rabbit holes that I want to go down, and I want to ask them about their lives and paint a fuller picture of their lives and not just reduce them to their accounts of living with COVID. And I'm still grappling with how to do that justice, because I think there's some really important work to be done, particularly in the case of public housing residents, where there's stigma and associations with them being dole bludgers, economically unproductive citizens, etc. I think there's really valuable work to be done in humanising and showing their rich lives. And I have yet to figure out how to balance that with the remit of the project, which I'm finding is quite constrained and circumscribing. But it's really affirming for me and generative to be able to have these discussions, and I guess, as Jazz was saying, embrace the mess and uncertainty, and hopefully find ways that we can pursue a kind of slow science, as Isabel Steng has put it, a science that doesn't erase the mess, and that sees in the mess nuance and value. So at least we're starting these discussions. I don't have any of the answers either, but I'm really heartened that we're embracing a sociology that engages these kind of tricky and possibly intractable questions.
Yeah.
Thank you.
So let's add to the mess with questions now.
Or solutions.
Oh, solutions are good. Tara has a solution.
Well, I have the answer, so I'm ready for it.
I knew you were special.
I really enjoyed all of your insights, and I learnt a lot. I guess my interest was in a thread across all three of your research projects around resilience and some of the shared cynicism around that word. And I guess my question is, how do you kind of emphasise the extraordinary ways in which the people you work with are coping without kind of buying into that very neoliberal kind of governance that deflects responsibility back on the individuals to bounce back from this kind of crisis, or from any kind of crisis, which all of your crises predated COVID?
Thank you. I can maybe start. That was a fantastic question. Thank you so much for that. Indeed. So I guess, again, I'm just going to talk about my case, but loneliness is, of course, dominated by psychological research. And so the focus is always on the individual. And so when we think about ways of addressing loneliness, it's always about what can we create for the individual to develop resilience or to be more proactive about it. So we're kind of blaming the survivor in a way, because a lot of my participants are frail, they're lonely, they're old, or they live alone, or they live in aged care facilities. So they have what we call a mix of structural vulnerabilities to deal with. And so when I talk about how my participants cope, or manage their loneliness. That's the words, the expressions that I use, how they are coping and management, how they are managing their, I don't say resilience because of that individualistic ethos as well, but also that neoliberal idea of it's the individual's fault for why do you feel lonely? You just go and make friends. And even when I do public engagement, so I wrote this article for The Conversation based on the diaries of my participants, and I had this, I would say, barrage of comments from older people who are not lonely, telling other older people that were part of my study to go and just find friends, to maybe if they are not so cranky, maybe if they are a bit more open, maybe if they want to join their local university. And so again, the focus is continuously on the individual, even though we're talking about lived experiences of people who feel lonely. And so I think that's why I think I'm so, I won't say upset, but I react. I'm very uncomfortable with the word resilience because of that individual aspect. So I just say coping and managing loneliness, and I think that's enough. But I should also say that I do work with people with persistent loneliness. So their management and coping is not to cure their loneliness, it's just to survive. So maybe if I work with people who were lonely before, but they're not lonely anymore, maybe I would find forms of resilience. But in my case, it's just coping and managing, which is quite active, even though people think older people are quite passive. Thank you.
Yeah, thanks for this question. It's really hard. I think emphasizing that the system is failing people is really important when, because it reminds me of during COVID how sometimes politicians or even public health commentators would always use that word, oh, people are very resilient. And I guess one of the things that I try to do sometimes is just showing how people have turned to apps or to wearables or to various technologies because the system has failed them. And it's failed them in many different ways. It's failed them because they feel pathologized. They don't want to be given a diagnosis, they just want some support. They don't want to be told, oh, you have depression, go take some Prozac. They want some empathy, really. And when the system fails, people have no choice than to turn to themselves, to technology and to their to people close to them. And I think I try to emphasize that, definitely never use the word. And also, one of the things that I'm always fascinated with when it comes to technology is how it's both a product of institutional knowledge, but in the way people use it, they find ways to disrupt something like psychiatry. They find ways to bypass it or to challenge the norms that psychiatry very often reproduces. That's what I try to do. Yeah.
Nice. Kiran, anything you'd like to add?
Thank you so much. That's such a rich question, and I think it goes to the heart of what we look at in sociology, the structure-agency debate. And I guess similar to Jazz and Barbara, I guess it's about, as you were saying, showing the failures of the system and highlighting the structural factors that impact people. So even where they might be managing or coping, what are some of the constraints on their agency? And I think we always go back to that in sociology, and that's what distinguishes us so well from psychology. My other area of interest, I guess, is addiction, and so a lot of the work that we've done there is to show how it's been understood recently as a disorder of individual compulsion, and the claim is that destigmatizes it, but of course we know disease is deeply stigmatized, so it really shifts the targets of stigma. But what we've tried to do in that work is to disrupt some of those assumptions that would responsibilize and individualize people and say, well, if you can just stop and abstain from drug use, things will get better, and demonstrate that actually this thing that we call addiction, this really nebulous, vague concept that actually shows our fear of dependence and is kind of deeply neoliberal in some of the binaries that structure it. Actually, it's as much a product of structural factors such as prohibitionist drug policy, homelessness, precarity, marginalization, as it is an individual failing. And I think that's all of our work is animated by that concern to demonstrate that there are structural factors beyond individual control, or factors that constrain individuals' agency and that shape vulnerabilities and reproduce inequalities in particular ways. And I guess in the case of people experiencing addiction, we've shown that, people can actually be not only coping or managing, as we've used those terms, but actually thriving and living a really full, rich life with the kind of drug use that would normally attract a diagnosis of addiction. So I share in common with Jazz a deep skepticism for psychiatric diagnoses and labels. I'm not sure of their utility, or I think they have limited utility. So yeah, I guess I would just say that it comes back to drawing attention to those structural factors that constrain people and limit what they're able to do, and just drawing attention to those.
I know we're running a little bit out of time, but can we take just one or two more questions? I thought I saw another hand earlier.
I saw someone trying to clap.
Maybe I just want to emphasize that it doesn't mean that coping and management is not resilience as well. Mm-hmm. I just want to emphasize that really clearly. So.
Okay, go ahead.
Thank you, panellists. I was just curious if you had observed, and I come from a creative arts background, but through each of you all practice obviously very humanist kind of ethics in your various practices.
It's okay.
I think this is unnecessary. So I was just wondering if you had noted, or there's some way of quantifying in the process of your conducting your research, if that is a factor in improving, or in a personalised way, some of the hardships that you as you frame them as partners or your participants are experiencing. Is that something that's trackable, that you get feedback around?
So I actually, because I've been failing at communicating my research, every time I talk about my research, people ask me, why don't you study children instead, the future? Or, Barbara, you're so young, why are you into old people? I actually collaborated with a creative writer to translate some of the stories of my participants into short stories, creative stories that give them also agency and autonomy. So on the one hand, I've seen that power of storytelling, which is something that doesn't come really natural to me because I'm trained in quantitative methods. And so, but I've seen the difference between reading the stories that Josephine Wilson, she's an Australian writer, she was the Miles Franklin Literary Awardee, wrote based on my participants, versus me with my clinical PowerPoint about this is the problem. So I think it created empathy in terms of a better understanding of my participants' lived experiences and different empathy that I was not able to create as a scientific communicator. That's one aspect that I could probably provide with for this conversation. The other one is the diaries. It was funny to see that all my participants at the end of the diary wrote about the power of the diary to even reflect on their loneliness. So they know they're lonely, but the way that they kind of engaged with loneliness was different. So they would say, this was really helpful for me, even as a way of thinking about my own life and my own loneliness. Sometimes it made it worse. But at the end, there was like this positive outcome from actually writing about it that I haven't explored yet. But it was something that I thought was really interesting insight into the power of this kind of creative methods. Thank you for that question.
Yeah, thanks. Just very briefly, the Borderline Personality project I'm on has kind of 3 connected methods, and one of them is it's completed now a series of creative workshops with people not necessarily living with diagnosis. We also recruited people who might identify with the diagnosis but don't have it, or people who don't identify with the diagnosis but have it. So it required a lot of flexibility in recruitment, which I think is very valuable when doing mental health research. There were a series of creative workshops. One of them was on filmmaking, one of them was just on whatever medium, art making as well. What participants get out of it is really humbling to witness. And also, I think I've always been really struck and I'm sure it's the same in a lot of fields, but the generosity of participants in sharing some very intensely personal stuff is quite amazing. And their own hope that this will improve the system, even the very cynical person that I am just has to be amazed by that.
Kiran, is there anything you wanted to add to that?
Yeah, I guess similar to Jazz, I'm not a quantitative researcher, and I haven't engaged in many creative methods in the kind of sense of creative that I think you're meaning here. But I suppose the changes I see are like small little incremental changes where you kind of see a shift in participants' habitus or their understanding of themselves, or conversely when I'm teaching students and drawing on some of this research material, having them come up to me afterwards and say, wow, that's really changed the way I see addiction, or changed my view of public housing residents. It's challenged some of my stereotypes, and those might seem like really small wins, but I think with the kind of small-scale qualitative research that we do, those are as significant as perhaps more of the quantifiable metrics that measure, how you evaluate success. So I take those as evidence that the research is making a difference, but it's incremental. It's like a small shift in people's understandings. And if there are creative ways that we could measure this or assess this, I'd be really interested to hear people's thoughts. It's not an area that I'm very familiar with.
Thank you.
I think we're ready now.
Yeah.
Yes. All right. Let's think
Thanks, Matt, for those
Thank you.
extraordinary questions. I never ever experienced such meaningful and deep
such
questions.
interrogation.
No, like really interesting and thought-provoking questions. Thank you so much.
That's really kind. I should just say big thanks to Graham for helping.
Thank you.
It actually worked, the tech. And thanks to Sarah for putting this all together. Obviously, it's a huge and Kate as well for helping out with all the tech on the day. We literally it wouldn't have happened without Kate.
Oh my God.
This is where we'll say goodbye to our folks on Zoom. Thanks for joining us. Thanks so much, Kiran. Hopefully the tests stay negative, and we'll see you in person again soon. And take care. And
Okay. Thanks, everyone.
Thanks, Kiran.
Thanks.
Thanks.